Morning, everyone. I just wanted to do a little recording here and talk about Guatemala and the clinical immersion trip to Parula in Guatemala and some of the fascinating reasons that people have gone in the past and why you might want to think about going in the future. So I'm going to move this here out of the way. So we partner with Anda Health, which is a mission that uh, quarterly goes to Parula, Guatemala. They also have a clinic established there and are looking at hiring a nurse to be there full time, even when the providers aren't there, just for that continuity of care. So their mission is to reduce disparities caused by social factors that occur in rural Guatemala. It's an impoverished area, and due to the poverty and the rural aspects of its location, that they have difficulty receiving routine medical care. This is the website that you can, if you want to look at Honda Health and its mission and its trips, uh, and um, and its chief medical officer. That is all listed there on the website. So why Parula, you may be asking. So why Parula specifically? It's a rural underserved community in Guatemala. That is really the focus of the outreach efforts. Again, I had mentioned that the disparities of care, they do not have regular access to medical care. And so that is why specifically Parula. This is the fantastic group of students that went in February of 2025. They went to Guatemala, and this is a mix of BSN students, DEMSN students, and DNP students. DNP students, including the nurse practitioner track, as well as the ethical leadership track. We also had a BSN completion student go with us, and it was just a fantastic group of nurses. So you might think, why should I go? I can't speak. Language is a barrier. We have plenty of interpreters that go with us. As you can see here, this is our group of interpreters that the mission hires from Guatemala City or their surrounding areas, and then they bring them out and they're with us for the week. And so we arrive, fly in typically on a Friday, and they unload the bus. We go in on a bus, they unload it. The cafeteria, the dorms, and the clinic are all in the same area, compound area. And the weather is beautiful, so the clinic, it's not like our medical clinics here in the United States. A lot of the clinic area is like what we would typically call the lobby, is outside space, because the weather is so beautiful. We took pictures of chickens this last time around. They free roaming. So what do we do in Guatemala? Well, we provide primary care. Sometimes we have a specialist that is an expert in doing ultrasounds. And so we're able to do ultrasounds right there as a point of care. Sometimes that's not readily available to us and we're not able to do ultrasounds. And so that either waits until the next time that we're there, or not we, but next time the Anda Health is there, or we would order that out, make a referral for that ultrasound if that would be needed. This visit, we were able to do a point of care ultrasound. There is a pharmacy in the clinic, and so able to dispense the medications. There is a formulary that we prescribe directly from. That way, patients are able to obtain their medications regularly without a break in medication regimens due to not being able to access the pharmacy or not being able to afford the medications. Uh, As you can see, this is again this picture on the far left. You can see the real estate of like the lobby area that's outside environment, and then the exam rooms are here on the right with people lined up waiting to be seen. And so the clinics look a little bit different than what we typically see here in the United States, which I think is just a fun aspect of going. So these were our nurse practitioner DNP students that went this last in February 2025. And they were standing in front of their examination rooms waiting to see patients. Um, so again, this is just more of a picture of just patient care. This is one of our BSN students, and she was providing post-operative care to a pediatric patient after surgery, which is just a rewarding experience, as you can see from her face. It's just a very rewarding experience. And so you may be asking, like, so I'm not a DNP student, I'm not a nurse practitioner track, or I'm not in the ethical leadership track. Like, what would I be doing? Well, you would either you do rotations throughout the whole compound area. Sometimes there is assistance in the pharmacy with filling medication bottles for pharmacy to dispense. We all take what turns with filling those bottles, lab in the clinic and drawing labs for patients. And then there is pre-op, and then the operative period in being a surgical nurse, and then with post-op and taking care of patients right after surgery, and then providing that patient education and those discharge instructions and getting them ready to go home. Post-surgery, they either go home the same day or they go home the very next morning. They're not prolonged recovery times within the clinic or in the surgery area. There's a very rapid turnaround time for them to be discharged to home. And so you can see this is one of our BSN students. She is very hands-on in assisting the surgeon during this surgery. I believe it was a gallbladder removal surgery that you see here. And so you have lots of cool opportunities to really utilize your assessment skills and your interventions. These are just some of the surgeries that were done in February 2025. And you can see this pediatric patient with the foot. This pediatric patient had 6 toes, so that 6 toe was removed. This is this is a lipoma here. It was just massive. Here, this middle picture, and here, these 2 pictures on the far right, gallbladder full of gallstones. And then here on this bottom right, I believe was the lipoma being removed. We are lucky enough that we also do a rotation in the schools. And so the nursing students do a public education with the students, whether that's hand washing or first aid or brushing their teeth or nutrition or exercise. Like, lots of different topics have been done in the past years. Students are really you can pick your topic, and then you go and you educate the students, and then you do that activity, whether it's washing their hands or brushing their teeth or some fun activity. It's super rewarding. As you can see, the students just love it, as well as the nursing students. Nurse practitioner track students also go, and they do well child exams during this school visit. And then we also had the DMP student and the ethical leadership track go and do some leadership activities with the whole enterprise. And so again, it's a very fun experience. You have break time during the clinic day. The students, as you can see here, went for walks. There were some chickens and baby chicks on the clinic compound. And so they were very well enjoyed. And then there were some baby kittens. So a team that eats together succeeds together. And so we do eat our meals together. Lunch or breakfast starts at 7 a.m. and we all gather for breakfast. And then we have our team assignments and where you're going to be in the clinic. And whether you're rotating or whether you're going to the school, and that's all assigned, and you have your assignment starting out, and then everybody kind of breaks and goes to their spots, whether that's in the clinic or in the surgery, or maybe you're on the school rotation that day. And then after the whole clinic day, we meet back together and we have supper together and we really debrief and enjoy each other's company. And then it's lights out and time to start the next day. And that is, so we arrive on a Friday, clinic starts, we do some pre-operative and clinic set up on Saturday. And then clinic is open on Sunday and surgery start on Sunday. And then it goes Sunday through Thursday. And then the clinic closes for the week that following Thursday. This is just one of the pediatric kids and she's just cute as a button. These were some of our nursing students, BSN students, our NP students. This is one of our interpreters that regularly works with us. And this is one in past years, he went with us as a BSN completion student. He brought his girlfriend back in February 2025, just because he found it such a rewarding experience and wanted to go again on his own, which is just tells you what a fantastic experience it is. These are just some nice group pictures because during this week visit, you just develop these fantastic relationships with each other and with the other healthcare members. And when I say other healthcare members, like we don't go there and it's just us, we go with On to Health and we go with other volunteers. And so there'll be surgery nurses, surgeons from other institutions that volunteer to go. And so it becomes this whole group team dynamic and you develop these fantastic relationships. Again, just the group photos. Dr. Evelyn is the medical director. And he was a surgeon in Texas and then just was called to serve in Guatemala. And so he has been largely in Guatemala. He still lives in Texas, but is really largely in Guatemala serving his mission. And so then we close on Thursday and then we have to do inventory because they need to know what we use during the week so that they can replace it because they don't have UPS and they don't have FedExpress and they don't have Amazon. And so, you know, it kind of hurts me a little bit too, knowing that they don't have Amazon. So any supplies that we use, they have to be brought back over. And so they need a really detailed inventory list. So we do a detailed inventory after the clinic closes on Thursday. Usually that takes, everybody pitches in and it usually takes about a half a day to complete that. And so then why should you go? Like, why? Well, you gain that hands-on global experience, right? It gives you that cultural competence in care. It really helps you to appreciate that diversity in healthcare. And then sometimes we get so set and like, this is how healthcare is, when really healthcare is really happens on this global perspective and on this global scale. And so it gives you that opportunity to become part of that global healthcare system. You also are able to strengthen your clinical skills no matter where you are in your practice, whether you are already a practicing RN, whether you are not a registered nurse yet, but you have all these skills that you've learned in the last couple of years, and it really helps you to build that firm foundation before you start your nursing practice. As a nurse practitioner student, you develop that nice firm foundation and you just spread your wings, and it just gives you that confidence in your abilities, and ready to take that next step in your practice. It makes that lasting impact. So when you come back, you are able to reflect on the changes that have happened, not just to your profession, but to you as a person. Also, what is it like here at home? It's so cold. They call Guatemala the land of eternal spring, and it is. It's beautiful there. Here are some beautiful pictures. So we close the clinic, we do inventory, and then Friday we go to Antigua. And Antigua is where we have more cultural immersion from a different aspect, not from the healthcare aspect, but from a purely cultural immersion aspect. And it gives us time to really reflect on the past week of care that we provided, and then how that has changed us and changed our practice, and it gives us that time to decompress before we return home. And these are just some beautiful pictures. This middle picture is actually our hotel. You can see some of these rooms. There's about 6 courtyards in the hotel, where the hotel rooms surround these courtyards, and it's just beautiful. One of the volcanoes that are outline of around Antigua, and some of the remains, historical remains in Antigua. There's several coffee plantations in Antigua. If you're a coffee drinker, they make delicious coffee. And so this is one of the coffee plantations. Just beautiful flowers. Our BSN nursing students, one of the activities, the excursions that you can choose to do on our weekend in Antigua is hike the volcano, one of the volcanoes. And so this is what this group of students did. We do have a team dinner on that Friday night where we all gather together, and it's a cultural immersion team dinner, and it's quite enjoyable. And so this is just that picture where we did. So in 2019, this is the whole group that went to Guatemala, not just, again, Viterbo, but from all sections of the United States. In 2020, our group. In 2021, we had COVID, and so we were grounded, but we went back in 2022, and this was purely the Viterbo group. This is part of the group, not the full group in 2023. I just thought this picture was amazing because there was some of the students with some of the Guatemalan children. This is our group in 2025, again, in February 2025. And hopefully we're gonna put your picture here for 2026. So you say, well, about how much does it cost? It costs around $2,800 for the trip itself. You earn around 60 hours for your capstone or your clinical experience, but you want to verify that with your clinical instructors. Every program is a little bit different, so I don't like to say it's a hard and tried rule or a hard and fast rule on those 60 hours. But in general, it is around 60 hours, but verify that with your clinical instructors or with your capstone professor. Funding opportunities, so cost-wise, the $2,700 to $2,800, you do have to buy your flight outside of that cost, and so that cost is around $900. If you have flight miles, that can reduce that flight cost. And so there are funding opportunities. I would encourage you to reach out to the Study Abroad office, ASEEM, She can help you with possible funding opportunities as well as the financial aid office. There are some scholarship opportunities that are available. We also will do a fundraising opportunity when all of the applications are in. We do the fundraising opportunity in December. It's not for a large amount, so I don't want you to think that'll pay for your whole trip. It's enough for about pocket money. Last year we did it, and I think they got $150. So it's not significant, but enough for some pocket money. So I hope to see you there. Please reach out. I'm Sherry Harris, again, one of the faculty at Viterbo, and I would love to see your face in 2026.